Hi, everybody. Welcome back to Lit Careers Ignite 2025 Careers Reimagined. Our next presentation is by Donah Justice, Certified Career Coach. Donah is going to be speaking on graduate programs and careers in healthcare and finding your fit. So, Donah, please take it away.
And thank you, Mario, and thank you for everyone for being here today. I'm excited to share with you more about graduate programs and careers in healthcare. I have been a certified career coach for the past, I want to say going on 10 years, but I've worked one-on-one with individuals for over 14 years, really helping them with their career and education journeys. And one of the aspects I really enjoy about being a part of someone's journey is helping someone remember their strengths, their why. And more importantly, when you get to that next step, seeing you go off into that graduate program or that job. So this is something that I love to do. Also, educating individuals is something that I feel really powerful as well. So really highly commend you for being here today. You're taking that steps to learn more about yourself, to see what's going to be the best fit for you, especially when it comes into healthcare. So I want this to be a conversation today. As I'm going through the slides, I may ask for your feedback in the chat. So if you have access to the chat, feel free to write your responses in there. If you have any questions, add them to the chat as well. I'll review those at the end and talk more about them. But if you can do me a favor with that, if you can put Q next to your question, that'll just be easier to filter it through when we get to the end. So, as a career coach, I'm very big on telling people the why behind why we suggest things. So, I'm sure you're wondering also the why of why I'm presenting this topic. And this really comes from my own career journey. I'm a first generation student, and a lot of the careers I knew about were with what I saw in my family. I had a lot of people in education, in food worker industries. But when it came to healthcare, I really only knew about doctors and nurses because that's what I saw in my community. When I went to university, though, I started meeting students who were majoring in majors I never heard of or talking about programs I never heard of. I can always remember my best friend telling me I'm going into occupational therapy and me thinking like, what is that? And her explaining more about it and finding it really interesting and saying like, hey, I wish I would have known about this earlier on. This might have been something that I was interested in. Years later, I ended up becoming a career coach at a university, and I started to see a big need for supporting the pre-health populations. Pre-health populations are students who want to go apply to medical school, optometry school, veterinary school, and it really resonated with these students because as we go through this presentation, you'll see that there's a lot of components that go into applying for these programs. And the students rightfully so had questions. How do I apply? How do I make an essay? What is this test that I need to take? So I am someone that's naturally very curious. So when I saw this need, I decided to jump in, see how I can get more research and support these students. And I was very fortunate to help many students not only learn more about applying to graduate programs and professional programs in healthcare, but see them get in as well. So to start off with, being in this presentation, I'm assuming that you're very curious about the healthcare industry. So if you're at a stage of like, hey, I'm interested in being in the healthcare industry, know a little bit about it, but don't know what kind of opportunities or jobs are there, this slide is going to be for you. So healthcare is such a diverse and a dynamic industry, and it's one of the industries that is projected to have a lot of job outgrowth, bringing more job opportunities in the future. The U.S. Bureau of Labor and Statistics predicts it's going to be around 1.9 million openings. So for somebody who it's important for you to have a lot of opportunities down the line, this is a great career to consider. But something we want to take note of is there specific jobs in healthcare that are going to have more job opportunities than others, really based on what's happening in our society and what's a need at that point. So some areas that are going to have job outgrowth are specialized areas. As adults tend to get older and need more support, the geriatric industry is going to need more healthcare professionals to support with that population. Mental health is something that is already talked about, but they're predicting there's going to be more need for social workers, licensed professional counselors. And something that I even saw when working at the university that is highly promoted because it is still a big need is healthcare providers in rural areas. When I was working with students, there was actually some programs. There's a physician assistant program I'm thinking about that knew that this was a high need, and they actually sent their students to rural areas for the internship to get that experience. Other job needs are going to be practicing professionals, nurse practitioners, physician assistants, home health aides. This is really going to connect to the geriatric population of how to support people in their homes and in outplacement. And another area that I know for me, I tend to forget a lot that is much needed in healthcare is technology. We always know we focus like healthcare is helping people, but at the end of the day, right, it is a business and it is an entity that has files it needs to protect, data it needs to support. So some jobs are going to have a great outgrowth in the technology side are cybersecurity, AI, and data analyst. So we can see just by this, there's a lot of different opportunities in healthcare. But before you start doing research, I always recommend to do some self-reflection and see these different components about yourself based on what you know, what job is going to be a best fit for you. So what I mean by that is when we start to research different jobs, I've definitely done this before. I start to see salary and then I get really interested. So let's say if I'm looking at an anesthesiologist position, of course, that's going to be a salary in the hundreds of thousands. That's very attractive. But if I looked at some of these components below, personality, skills, and interests, I have to make an assessment of do my personalities, interests, skills, and values too connect with being an anesthesiologist. So I'm going to go through these different traits. And as I go through them, if you have a pen or paper, have your phone, I highly encourage you, if something comes up for you as I'm talking about these different sections, write it down. Start to create your foundation in this self-reflection tool so that when we talk in the next slide about exploring different healthcare professions, you can already start to see comparison between who you are in those different positions. So the first trait I want to talk about is values. What a value is something that I like to think about as a non-negotiable, like something that has to be present in a job in order for you to take it and for you to feel motivated. That looks different for everybody. For some individuals, it could be salary. Others, it can be, I want to be a leader. For others, it can be mission-based. Like, I want to make sure I'm working for a company that has this specific mission. For others, it may be a balance of being able to take care of family and work. So with values, I always like to tell individuals too that these can change over the years. But at this point, what would those values look like for you? Next, we have personality. Personality comes out in your career in different dynamics, such as, are you somebody who is more detailed oriented versus abstract thinking? Do you like more structure in your day or like to have flexibility? Are you somebody who maybe makes more decisions based on feelings versus logic? And then where do you get your energy? If you're in a big crowd, do you feel energized and ready and motivated? Or do you prefer maybe getting your energy from yourself, taking time to do self-reflection? Personality can look different in the healthcare industry. If we think about let's say a scientist, and I'll use myself as an example. As a scientist, that may be somebody who is really value structure, has a personality who maybe gets energy from more of that self-reflection and is maybe detail-oriented. I can tell you with my personality, those are all opposite of what naturally comes to me. So I may try to be a scientist, I may have the skills to do it, but at the end of the day, because my personality does not exactly match that industry, it may get harder for me over time to stay motivated in that field because my natural personality is not connected to that role. Next, we have interest. So what are those areas, especially within healthcare, that when somebody brings it up, you want to talk about it, you like to read articles or look at the news. So maybe you're someone that you really like technology and you like learning what's the newest, what's going on with AI or what's going on with cybersecurity. But for others, it maybe have a big interest in preventative health. I want to make sure that people are there's less diabetes in the world or people are being more heart healthy friendly. And our last section is the skill section. So skills are your strengths. What are those areas that come naturally to you that others say you do well or people come to you for advice? If this is an area that you're like, hey, I'm either still developing my strengths or I'm not sure what they are, I definitely recommend for you to reach out to your network, family, and friends, and just start to ask them. I think you'll start to see themes come up, whether it's they're telling you you're really great at communication, or you're really great at problem solving, or I know you're seeing you do really well in your science classes. That can be a good starter to the conversation to help you explore more. So now that we have these self-reflection tools, the next area that you can start to explore are different online exploration tools. So I'll stop sharing my screen in a second so I can actually show you some of these websites. But these are all free websites that give you more information on different careers in healthcare. Now, I will say with this, I would consider this the starting point to exploration. Once you start to look at different careers, we want to use those self-exploration tools in the beginning to do that comparison. But if you're narrowing it down to one or two options, at that point, what I would suggest is either one, talking to people who work in that field to ask them questions about what does their day-to-day look like? What did graduate or professional programs look like for them when they attended? And also getting experience. So experience, I always think, is the best way you can make a decision of, is this going to be the right field for you? And experience can be everything from volunteering, maybe taking a part-time position, or even moving into a full-time position. But those different knowledge points, especially the practical experience, can save you a lot of time and resources, especially if you are in something and then decide, you know what, I'm doing this is not a good fit for me. That's okay. That's vital information that maybe saved you time, money from applying for a program that may not be a good fit for you. So I'm going to stop sharing really quick and then switch over to the first resource. And for any reason, if you can't see my chat, if technology is not our friend today, just let me know. But if you can see where it says healthcare pathway, we're good to go. If you can't, let me know in the chat and then I'll reshare. Perfect. So healthcare pathway, this is a free resource online. Why I really like this is when we come over here, it has a nice visual that breaks down healthcare into different pathways. And when you click on each pathway, it's going to give you a list of different healthcare careers that connect to that pathway. So going back to that self-reflection tool, from there you notice, hey, I'm somebody who is looking like a good fit for me based on my values, skills, personality, and interests, is working more in with direct patient care. If this is something that I'm really interested in, you can come over here. And when you go to the bottom, this is going to give you a variety of different careers that connect to direct patient care. Now, this isn't the end all be all list, but this is a good starting point to start to see what type of opportunities are on there. I even think just looking at these lists, if you start to look at it and you're getting excited, that's a good knowledge point. If you're looking at this list, you're like, oh, this is not exactly what I thought. Still a good knowledge point to see what's another way you can redirect and look at other opportunities. But on here, when you click on the career, this is going to give you more information about it. Certification, salary. So it's a very broad overview of it, but if you're reading this and you're like, hey, I'm liking this, put a note to it. What you'll want to do next is continue exploring online on Google, other research tools to learn more about, let's say in this case, audiology, to make that assessment of, do I want to take that next step to reach out to somebody or get that experience in the area? Now, for the other one, I'm going to switch to Healthcare Explorer. Can you let me know in the chat if it's switched over? Awesome. So with Healthcare Explorer, what I like about this is it has a mini career explorer that can be a good reality check. I know I talked about earlier the salary, right? So right now, if I just put a certain salary and press submit, I can see different careers in healthcare that have that salary. So these are attractive, right? I may click on this and say, okay, I really like this salary. I'm going to become a dentist. But we want to take that pause, look into what it requires of being a dentist. Is it matching who we are? Again, looking for myself, this is not going to be a good match for myself. Something else too is the years of education. You may be looking at this and saying, hey, like I actually like this. A lot of times the years of education plays a part in if we decide to go down that field. That comes more down to value. Do you have the value? Are you willing to invest your time, money, resources into a certain years of being in school to become this profession? And the last resource is public health careers. So this is going to be more for careers that I like to call them maybe more behind the scenes, like administration. Sometimes they are forward facing, like social work, counseling. But this one also has a career explorer. I already took it, but what it did is it asked me questions about what I like to do. Do you like to build things? Do you like to help people? And from there, it gave me these different interest areas. But what I think is really unique is very similar to the Explore Healthcare careers. It tells you based on how much experience, degrees you want to get, what type of opportunities are available based on your interest. So that's a great thing. I think there's so much knowledge and tools out there to do that exploration. But I always say it's up to the person reviewing it. It's your due diligence to go see like what resources are out there, what's going to be a best fit for me. And as you're researching, what you're quickly going to start to notice is, are you going to need a graduate or professional degree? Now, with the healthcare setting, I will say that a good majority of careers are going to need some type of additional education or experience that's outside of a high school degree. But the type of experience, the number of years really depends on the role. So this is a breakdown of different types of degrees. The first one, certification, it's really not a degree because it's a very specialized program. We can see here it's much shorter than the other the degrees on here, like master's, PhD, and professional degree. And the reason for it is because when you enter a certification program, you're learning a specific skill or a specific niche. For dental assistant, for instance, if you are in that program, you're learning the tools, how to assist a dentist. You may not be learning about other aspects of dentistry. So certifications can be great for those who maybe want to make that career switch and test it out because it doesn't have that longer time commitment. Or it may be for someone who a value isn't to be in school for a long period of time, but they still want to be in the healthcare setting. Now, there are bachelor's degrees in healthcare. With those bachelor's degrees, there's bachelor's of biology, public health, psychology. What I tend to see though is that bachelor's degree is either bridged to get a master's, PhD, or professional degree. So there are opportunities to work maybe in a nonprofit or different sectors after that bachelor's, but a lot of times people in those industries may find themselves getting more education, either to get to that next step in their career or to get into the specialty they want, like a professional program. So up next is master's degrees. Master's degrees are 1 to 3 years. These are typically for individuals who want to start specializing in a certain area, healthcare, public health, social work, with the goal of using that knowledge to work in that industry. Sometimes master's degrees may be also bridge opportunities to get into PhD degrees. PhD degrees have a big emphasis on research. So for somebody who, let's say, went to a bachelor's program, didn't get that research experience, they may use that master's degree to get that research experience to apply for a PhD program. Now, PhD programs, like I said, very highly research focused. You end up creating your own research project, presenting it to a committee, and if they approve it, that's when you become the doctor of your specialization. So doctor of health science, doctor of psychology, doctor of epidemiology. What attracts a lot of people to PhD degrees is one, the versatility in the type of opportunities you get. So for someone with a doctorate degree, they may think like, hey, I really want to keep focusing on research, or maybe I want to become a professor down the line, or I want to keep my option to also still be in the industry. Lastly, we have the professional degree. So these are going to be more the clinical facing roles that we typically think of in healthcare: doctor of medicine, physical therapy, occupational therapy, optometry, veterinary. With these, they are longer programs. The longest one is going to be doctor of medicine, particularly because of the specialty. So if you're someone who's interested in going to medical school, what your path may look like is you do 4 years of your bachelor's, 4 years in medical school, and then you have additional years you do depending on what specialty you match into. So somebody who is a family doctor, maybe they're only doing 3 additional years, versus somebody who's a neurosurgeon, and they may have 4 to 6 years of additional study. So going back to the self-reflection, is really important to know how much time you'd like to invest in education, especially when you're researching. Because if you're somebody who says, hey, like I'm willing to like spend 10 years in school, great. But if you're not willing to make that commitment, what other degrees or what other opportunities will be a better fit for you? So if you do need to apply for a graduate or professional school program, one of the biggest recommendations I always tell people is know your deadlines, particularly for the professional school programs like medicine, physician assistant, physical therapy, occupational therapy. You are usually applying a year out before you start the program. So for physical therapy, for instance, if you're like, hey, I want to start next year the program, your application is actually opening up this June 2025. So what that looks like is June 2025, your application opens up. In the summer, you're applying. When it comes more to that August, December range, you're interviewing. May still be applying to different programs, but in the spring semester, you're hearing back from your programs, you're making a decision of which one you want to attend. Something I don't think is talked enough about this too, though, is that for a lot of people, you do end up having to move to a different city, a different state. So you're also taking that into consideration, the logistics, finances. of moving to a new location, and then you're starting your program in that late May, June area. So that's why it's really important to know when does your application open for your program and then what that timeline looks like. Because ideally, these different application materials you'll want to have done before your deadline. Now, let's say for physical therapy school, the application opens up in June. The programs, their final deadlines to submit may look anywhere from like September even to the spring. But something you have to take note of is these programs have cohorts, right? So they can only take a certain number of people for each year. And if you're a strong candidate, but you're applying later, if it's just a really strong candidate pool, you may not have the chance to interview or to get into the program simply because of the timeline. So I always recommend if you can have these application materials before the application opens up, it just makes it easier for yourself. Now, when it comes to PhD and master's programs, they'll need these as well, but professional programs have a little bit differences in what these application materials look like, and I'll go through each of them. So with application and application fees, a tip I have for this is one, recognizing that each time you apply for a school, there's a cost to it. Again, this is something that we don't talk about as enough, but the application itself, like let's say for medical school, there's portals called TIMDAS, MCAS, where you actually submit your application. That itself may have a fee like $100 and let's say $70. And then they may say you have 2 schools that you can send to for free. But after that, there's an additional cost of maybe $25 to $60 per school. So that's something to take note of. There is going to be a financial commitment to apply for these programs, but many of these programs may have application fee waivers. What those are is that they'll look at a candidate's circumstances, maybe if it's like a background and income stamps that would make it really hard to apply for these programs. Sometimes I'll look into that and say, hey, we're either going to let you apply to this many number of programs for free or maybe at a reduced cost. So always highly recommend to look into that if it's a way that can save on some of those expenses. Next is the classes and transcript from each school. So this is something that I've seen students have a hard time with in the past of, let's say I'm in a bachelor's program, I took some community college classes in the past, but I'm only going to send my bachelor's degree to the university. If that program sees on that transcript that you took classes at another institution, even if it was a community college, they're gonna ask for that transcript. And if you're getting close to the deadline, that's just gonna add more pressure to you, right? So knowing you have to take your transcript from each school you've ever taken classes in, and with that too, knowing what classes to take. If you're currently at university, you can talk to your academic advisors. They'll be able to tell you which classes count for your program. If you're somebody who's already graduated, you can do something called a post-bac program where you can go to a university, not to get another degree, but to take classes for your program so you can submit to them. Experience is the next section. This is something that is vital not only with graduate programs, but with even job searches as well. What's unique to professional programs, though, is that sometimes they'll require certain experience. So physical therapy and occupational therapy programs will actually tell their candidates, you need to shadow a PT and OT for a certain number of hours. So a tip with this is, one, knowing the requirements for the programs you're interested in, but also planning ahead of when in my schedule can I add this shadowing opportunity so I meet the requirements. Personal statement and statement of purpose, I'll have a slide on this next, but this is the area that I've seen when it comes to the applications. Most people have a really challenging time of particularly because it's a very different way of writing than what is taught at school. Especially if you're in the science background, a lot of times you're taught to write with logic, write with facts. And with the personal statement, it really is personal. You're adding antidotes, different aspects about yourself that they can't see on the resume. So we'll talk more about this on the next slide, but this is an area that if you already know it may be a struggle for you as you begin to brainstorm or write, highly recommend getting extra support, either if you're in university with a career services academic advisor, or if you're outside university, seeing online support systems that could help you. Letters of recommendation. The programs will sometimes ask for specific people to write a letter of how you were as an employee, a student, if it's an internship coordinator, as an intern. My tip for letters of recommendation is do not give your recommender the actual deadline for the program to turn it in. The biggest reason is that we're human, right? And if that recommender, I'm thinking like of a professor, for instance, maybe they're in a really busy season, finals are coming up. If they don't write that recommendation and it's a day before the deadline is due, it's going to add a lot of pressure for you, and it may cause a chance that you don't actually get to submit your application. So what I always recommend for this, give your person at least 2 weeks to write it so they have time to think it out, but also make it maybe a month ahead of the deadline. So if your program, let's say you're like, I want to turn this in by April 24th, I would let them know March 24th is the deadline. So if for any reason they don't give it to you, you still have some leeway for them to complete it or for you to ask someone else. Next, the test score. So this is another area I'd highly encourage you to plan out. The test scores, if you've ever taken the SAT or ACT, these tests here like MCAT and GRE have a similar premise to it in that they test different subject areas that the programs want to see. Now, you need to know what kind of test taker you are and how much time you want to study. I have a master's in counseling. I had to take the GRE. I'm not a strong test taker, so I had to take it twice, and I had to study for a couple months each time. I had a colleague who studied in a week, and did great. Again, it all comes down to knowing about ourselves and what's going to be best, but this is an area you want to plan for. And with any of these application materials, I want to strongly advise you to think strategically about them. And what I mean by that is not trying to do all of them right before the deadline, because one, it's probably going to get overwhelming, and two, you may not be putting your best work forward because you're trying to juggle all these different areas. So an example of planning for the applications could look like this. Let's say your goal is next, going back to physical therapy. I'm not going to apply this year, but I'm going to apply for next June. I'm looking at my August, December schedule. Maybe I have a lot of work during that time, or I know maybe I'm taking a lot of hard classes. That may not be the time I want to study for the tests that I need. Maybe I'm going to save that for spring, but I know I have flexibility on the weekend. So maybe that's where I'm going to do my shadowing. And I know I want to start doing my personal statement maybe in May. So that way I can have more experience to talk about. So that's a way to think about it, where one is strategic, but also it makes sense for you to keep up with the goals of the application. And lastly, interviewing. Most professional programs will require an interview. When it comes to PhDs and master's programs, that's going to be dependent on the program. Interviewing, just a side note with that too, is that if you're applying for out of state or in a different city, if the interview's in person, you do have to go in person, fly, drive to that location. Interviewing, I would like to tell people when you get to that stage, they already know you do well academically. They already know about your experiences. So a lot of times they're trying to assess more those soft skills. Are you a team player? What does it look like if we bring you into this cohort? Are you truly invested, interested in this program? So again, another area where you know, like, hey, this may be something I want more practice in. I'm trying to find those resources and support to help you. So I know I mentioned I'm going to briefly talk about the personal statement and why it can make such an impact on your application. So right here, I have two examples of different excerpts from a personal statement. I want you to take just a couple of seconds to review both of them. And in the chat, let me know, does example one or example two stand out more for you? So whichever one you choose, just write it in the chat and then we'll see what the consensus is. So I'll give you all 30 seconds to review it. So it looks like a lot of consensus is two. And I agree. I think two has a stronger stance. For me, what I found really compelling is not only with this candidate, do you know more about what they shadowed? Like we see that they were helping put extra pillows, water, snacks. I also like that they were very honest in saying like, hey, I went into this and I didn't think I would like it, but it really changed my impact and made me more motivated to apply. Just reading this, like for me, I see somebody who can enter a challenging situation, be very objective about it, taking the information and then make a decision, which we think about in any clinical setting is so important. So this is what the power of the personal statement does. It allows us not only to see different experiences, but even see different strengths that candidates bring without directly mentioning them. So with all of these, with all this different information going from looking up what career is going to be the best fit for you into the graduate programs, and like I mentioned before, getting that support and resource can be such a vital next step for many people and not only educating themselves about what they need to do, but also just more important, feeling more confident about applying, whether it's for a job or graduate school. So these are some resources that I listed here. I'm always happy to help somebody in their graduate school journey, whether it's going into a healthcare program, outside of healthcare as well. That's my information. I'm very easy to reach out to on LinkedIn, but I have my email there as well. I would say the areas that I'm strongest in supporting it is with the documents. So if you need help writing a resume, curriculum vitae, personal statement, those are areas I really enjoy and have a lot of strengths in. I also put a colleague here, her name is Brianna Etoria. She has her own coaching company that's geared toward medical application. What I think is really cool about her program is she just doesn't only focus on how can I support you with applying to medical school. She starts from the beginning of, do you need help learning study strategies while you're in your bachelor's program? All the way up into the end to say, hey, once you get into medical school, let's have some coaching sessions to really help you be successful on this new journey. In addition to that, there are a lot of different freelancers, particularly when it comes to the personal statements and essays that can help you. There's websites like Fiverr, Upwork, you can search for people on LinkedIn. But when it comes to getting extra support, really know what kind of support you're looking for and again, what's going to be best for you. As a career coach, I always tell people I'm not going to be a career coach for everyone. Just because that wouldn't be fair to you, that wouldn't be fair to me, because I come with my own set of strengths, skills, and experiences that may connect with what somebody's looking for, but someone else may be looking for something different. So if you're somebody who maybe is looking for a really specific niche, like you want somebody who's been a physical therapist, been through the program, and is now helping people, that may be a good search tool to use. If you're someone who's like, maybe I want somebody with the counseling background because there's other aspects I want to talk about in the search, that could be another filter as well. But you have every right to ask questions, do research to again see who's going to be the best fit for you in your journey. So these are some additional resources that I pulled for the presentation. If you are still interested in looking at different trends, opportunities, highly recommend that you look at these websites. They're going to tell you a lot about not only what jobs are predicted to outgrow in the next couple of years, but it's also going to tell you what are the trends in the healthcare industry itself. So I'll take a pause here and start to look at the questions in the chat. But if you have any new questions, feel free to add them in there. Yeah, you're welcome. I thought there was a question about application fee. It really ranges by program. The initial fee, I think the highest that I saw probably is for medical school. I think it's around 175, but that's not including the fee to send it to each program, which may be around 25 to 60, depending on what the university put. Yeah, I'll give it a couple more seconds if anybody has questions. If you have questions along the way, let me go back to the other. Let me go back to the other screen that has my LinkedIn. Feel free to always send me a message on LinkedIn Connect. If anything in the presentation, if you have questions about or you want that extra support. But I want to thank you for taking the time today to learn more about these different topics, and I wish you the best of luck on your next career step.